Hi, I'm Jasmine, Angelica's cousin. She's a lazy girl. Here's what I was doing before. Today, I would like to show you guys something exciting, a medical procedure which will save many lives. The procedure is named after my cousin, Angelica Ulloa. It was developed by Mr. Tom Zhao in 2007, and since then, it has been used in his own clinic for 13 years. He uses this procedure for reducing the symptoms of anaphylaxis-related suffocation caused by bee sting treatment, pollen allergy, or allergy-related asthma attack. It works very well for this kind of symptom. It usually stops the suffocation in less than 2 minutes. Tom presented his proposal last year at Appenmondia 2019, an international conference held on September 8 of 2019 in Montreal, Canada. He also uploaded a YouTube video which explains how to perform this procedure step by step.
Caused by allergy. If you find patients perspiring or sweating, do not perform the pricking blood therapy on them. It means that their shortness of breath is not caused by suffocation, but a heart attack or low blood sugar or some other health issue caused by the allergy. Signs that may indicate pricking blood therapy may be appropriate include the following: itchiness in the throat along with a cough, goosebumps on the skin, trembling with chills and no sweat, hives which could be all over the body or localized, people with suffocation, and any one of the above symptoms is suitable for the pricking blood therapy. Additional symptoms may include sneezing, stuffy nose or runny nose with thin, clear mucus, shortness of breath or gasping for air, whole headaches. Some people also might not have any symptoms but suffocation only. Some people may also suffer severe body aches and a feeling of heaviness, perhaps with nausea, vomiting, and epigastric or chest oppression.
However, there are not many people paying attention. So far, less than 1,000 people have seen this video. I've been working at Dr. Tom's clinic every week, sometimes after school for the past year. I help him look after the patients and arrange natural medicine. In March 2020, the COVID-19 pandemic hit Los Angeles. Since then, we have encountered many patients with comorbidities, including moderate to severe acute respiratory distress syndrome after infected by COVID-19. Here is my cousin Angelica, who got ready to enter a patient's house. COVID-19 hit downtown Los Angeles really hard, especially in the Latino communities. Some patients in the critical conditions are sent home by the hospital, and it is impossible for them to move. Tom and my cousin had to visit them in their house. Tom applied Angelica's procedure to stop the suffocation symptom first, and then provided them with herbal medicine. Patients usually recovered in less than 7 days.
Longitude.
Quédese sentado un ratito. ¿Y cómo se siente?
¿Cómo te sientes? Better. ¿Cómo te sientes? Better.
She's feeling better, so her breathing is better. It's steady, look at it, it's on 97.
Yeah, it's 5.5. In 5 minutes.
Except for one 75-year-old female, she sadly passed away. She had a precondition of stroke and diabetes, and was in deep coma for 4 days before we tried to help her. Even with this critical condition, the oxygen saturation levels went up from 76% to 86% and remained that way for another 18 hours before her death. We found that Angelica's procedure can stop shortness of breath shockingly fast and effectively. The symptoms stopped in a couple of minutes. At the time we made this video, this procedure was performed on dozens of patients.
It was 86.
That's what the little paper said.
Open your mouth and try to take a deep breath. How do you feel your head? Is it uncomfortable again? How do you feel?
It was hurting on the way here and it's not hurting anymore.
96. Great.
Falling so much faster.
96. It's 1 minute 28 seconds.
You know how long it took us to go?
5 minutes. 95, 96. You are safe now. How is your breathing now? You feel
Better.
better? How is your chest?
I can do the deep breath.
Okay. That's great.
And the longest one was not more than 9 minutes. They did not need ventilation treatment or having to visit the ICU.
Just so that you guys can also know what we're doing. Después de esto, trate de hidratarse bastante. Pura sopita del agua de coco, Pedialyte, todo lo que le hace hacer ahorita, más respirar profundo, pero va a ser como mitad. Te va a ser bien importante hidratarse bastante. Y se va a sentir como una borrachera, eso va a ser normal. Porque ahorita lo que está pasando es el oxígeno entra a su sistema. Have her walk like a few steps just to see how the oxygen goes up or down. And she just goes running. Dije despacito, no dije que corra. She feels better. You're making her run. I told her slowly and she's already like running ahead. It's hilarious.
Well, isn't this cool? You guys want to learn more? Please follow me. It's super easy. You just prick the skin on the tip of the nose or forehead with something sharp, such as lancet device for blood sugar testing or a sewing needle. Draw about 300 to 400 micromillimeters of blood. The volume is about the size of 3 to 4 soybeans.
I have a set of Lancet devices usually used for blood sugar testing, a glove, and alcohol wipes. Now I need to load my Lancet device and prime it. Now that the Lancet device is loaded and primed, but how much blood should I let bleed out? According to Tom's hypothesis and experience, about 100 to 150 microliters should do. Less than the size of a soybean and larger than the size of a rice. How are you feeling?
Why does it work? How did Dr. Tom discover it? Well, it took Dr. Tom a while to figure this out. It's a long story. For details, please watch the other 2 videos in this channel. Here I show you guys some parts of them.
That such situations may be due to the reason which chemical or physical process blocks the pores and sweat glands of the human skin. This blockage triggers the self-protective stress response of the human body to shrink pores and sweat glands on the skin and the contraction of the trachea's muscles at the same time. In other words, if the pores or sweat glands tightens resulting in goosebumps due to any foreign stimulants such as cold water or allergy-inducing agents like antibiotics, it might affect all of the smooth muscles in the body, including airway muscles, to spasms, which is a systemic reaction. The swimmers in the winter are good examples to illustrate the mechanism of the human spontaneous stress response. The difference between the fatal cases and swimmers in the winter might only be in the degree of stress response and causative agents. Therefore, the traditional Chinese medical formula, which could open the contracted pores of the skin and the sweat glands due to the cold, can simultaneously relieve the contractions of the trachea's muscles. As for the phenomena of the airway edema and the pulmonary edema in anaphylactic shock of the deceased illustrated in the medical literature, it is only caused by the contraction of the trachea muscles and suffocation. It is a concomitant symptom along with smooth muscle contraction, not the cause of suffocation, that will aggravate asphyxia. The symptoms of the human stress response described above is the typical syndrome of cold wind tightening superficialities from the perspective of TCM practitioners. This can be relieved with formulas such as Mahang detergent, Advera soup, to induce perspiration. This speculation was cautiously verified with patients who got mouth, throat, or skin rash and began to cough after bee sting treatment. Advera soup could relieve the symptoms away in less than 2 minutes. However, the conditions of patients with drug-induced or venom-induced anaphylaxis usually are critical. Those patients could begin to have severe coughs, severely suffocate, or even enter a coma. All administration of medication would not be appropriate or impossible in these situations. Therefore, Mahang detergent should only be used in patients who do not have suffocation or are unconscious. For patients who are not suitable for oral administration, other effective first aid modalities should be prescribed. According to the Academy of Materia Medica, mucus secretion and nerve stimulation and soothe muscle contraction. This results in rhinorrhea, itchiness, dyspnea, and anaphylaxis. Zhao believed that it may be related to the individual's physique and the dose of the bee venom. The concentration of antigens and antibodies in sensitive individuals might be too high, exceeding the critical point of the individual's tolerance limit, triggering the individual's self-protective stress response, which includes tightening of the skin pores, sweat glands, and contraction of the trachea muscle. Bleeding at the tip of the nose can directly reduce the concentration of antigens and antibodies in the blood system, making it lower than the critical point, resulting in anaphylaxis, self-protective stress response, or overactive reaction to stop immediately. Since the human body's self-protective stress response system is very efficient and sensitive, one of 2 drops of blood are sufficient to terminate the reaction and stop the contraction of the trachea muscles. Apnea soup stops this deadly allergic reaction in another way. It opens up the pores of the sweat glands and simulates perspiration. This psychological reaction might result in the metabodies and antigen antibodies excrete off the victim's body, thus the concentration of antibodies or antigens in the victims could drop below the threshold of igniting the self-protective stress response. However, tightening of the pore or sweat glands on the skin and contraction of the trachea's muscle spasm are only one of the type of human stress response. The skin and trachea are the first human barriers in contact with the outside world, so the stress response is also the most superficial. Therefore, this kind of PBT solution cannot be used to deal with all stress responses of the internal organs or tissue in the interior human body. Exploring possible treatments for those stress responses is in the direction that scientists should study in the future. Combining this pricking blood therapy and bee venom allergic test bee sting therapy is safe. When Zhao introduced therapy to his practice, patients loved it. They found that it was especially effective for breast cancer, migraine, autoimmune disease such as systematic lupus. However,
if you or a loved one encounters suffocation because of an allergic asthma attack or an allergy caused by bee venom or food, without proper treatment, you or your loved one can die within minutes. It is important that the people around you recognize the problem so that they can better help you. So first, you should alert others that your suffocation is not caused by food being stuck in your throat or airway, but because of an allergy. Here is the body sign that we proposed for that purpose. You put one of your hands over your throat and the other one over your mouth this way, and you motion outwards and inwards. It is important that you do not use the universal choking sign that is also known as the Heimlich maneuver.
Parte, lo ven, hasta pierden de peso, mitosis. Yeah, it's at 94, and now it's dropping to 126.
We noticed that some patients with COVID-19 had pain on their chest area and upper back while breathing. They felt that their bodies were heavy, extremely fatigued, pain all over the body, headache, or dizziness. These symptoms went away once they were able to breathe normally again. But the procedure is useless for cough, diarrhea, loss of smell, or disturbed taste. For unknown reasons, the procedure could not achieve any immediate effects on the patients who had used steroids or ibuprofen for more than 2 days. These kinds of patients did get better 2 days later, but it might or might not be due to the therapeutic effect of Angelica's procedure. As you know, Angelica's procedure is developed for type 1 hypersensitivity, an immunoglobulin-mediated hypersensitivity reaction, which is based on the practice of bee sting therapy. Its purpose is only to stop the symptom of suffocation. It has many taboos and does not work for other symptoms of this type of anaphylaxis. Coronavirus-induced anaphylaxis is a type 4 hypersensitivity, which might be a lymphoid cell-mediated hypersensitivity or cell-mediated immunological reaction. How to prevent and treat this delayed type of allergic reaction are the challenges scientists and medical personnel must face. So far, in our practice, we only know that Angelica's procedure helps COVID-19 patients when they have symptoms. Unlike type 1 hypersensitivity related anaphylaxis, it works for many symptoms associated with type 4 hypersensitivity, including suffocation, shortness of breath. But why does it work and how does it work? We do not know for sure right now. Tom provided a possible explanation. Our bodies might allocate a significant portion of chemical energy such as ATP in our body to support the intense reaction of the anaphylaxis, in particular COVID-19 infected patients, which results in the less portion of the energy left to support the normal psychological activities such as cellular respiration, thus affecting arterial partial pressures of oxygen and carbon dioxide. Then, moderate to severe acute respiratory distress syndrome will occur if there is not sufficient oxygen level in the blood system. Angelica's procedure terminates the action of anaphylaxis by directly reducing the concentration of the coronavirus and the cells which mediate the hypersensitivity reaction in the blood system, making it lower than the critical point to start up the anaphylaxis. By human psychological homeostasis, action of cellular respiration will then be restored once sufficient chemical energy is available. We strongly suggest you guys see your family doctor or a licensed practitioner of traditional Chinese medicine for help if you or your loved ones have symptoms after being infected with COVID-19. Angelica's procedure should be your last resort. Angelica's procedure is not recommended for asymptomatic COVID-19 patients. Do not try to perform this procedure every day. If you think you might need another one after 2 days, ask a medical professional person to do it for you. If the symptom you have is not mitigated in less than 30 minutes, it means the procedure does not help the symptom. Do not try to draw more than 1 millimeter of blood each time. More blood does not mean increased effectiveness or rapid resolution. The patients in this video are real patients with real cases. They are not actors or actresses. The results are real. However, if you had taken steroids or ibuprofen or some traditional herbal supplements, please use this procedure with caution. It might not achieve any rapid effects as this video presents. If you want to test the therapeutic effect of Angelica's procedure, please use patients with acute asthma attack or acute psoriasis. The symptom of ARDS of asthma or itchiness from psoriasis should be relieved in less than 2 minutes after the procedure. COVID-19 is a new disease and nobody knows how to fix it. This is all we know. I hope this helps you guys in some way. If Angelica's procedure cannot stop shortness of breath, please call 911 or go to the emergency room. Bye everybody, take care.